But for so this question I actually posed to Dr. Chen because I think it's an insightful one, and you talked about local therapies. So there's a question in the audience about how they want to know about options for surgery for stage 4 patients and how we think about whether to incorporate surgery for stage 4.
Yeah, I think that is a really great question and something we are exploring more. I think traditionally, right, we don't think about surgery for stage 4 because we think about surgery as a curative option, and often that's not what we're thinking about in stage 4. I think about surgery in kind of two settings in the stage 4. So one, if someone has a patient has a metastasis that's going to be a life-threatening in an area, and the most commonly one could think about is perhaps metastasis to the brain or metastasis to the spine, where there is impending um, bad things are going to happen, brain swelling or affecting the spinal cord, potentially affecting the way that a patient can move, then surgery would be indicated because that is going to be the quickest route to resolve some of these medical emergencies. Now, surgery, as a discussion, has been thought about more now as consolidation therapy, right? So we have patients who, especially in patients with the EGFR or ALK and some of these other actionable mutations, where the TKI or targeted therapy has worked incredibly well, and all their other sites of metastases appear to be quite controlled, except for maybe that one that's just out there and is more stubborn. In that case, does surgery play a role as consolidation, or in this instance to radiation? So do we surgically remove that site? Do we radiate it? Does having that clean scan, mean better outcomes in the long run in terms of disease control? But more importantly, are patients going to live longer with that? I don't know that we know the definitive answers to that, but certainly it is an option. I think it's very individualized. It depends on the site of disease, how big it is, how surgically feasible it is to remove it. What are going to be the morbidity of doing a surgery there? You're going to have to hold your TKI therapy. Do we feel confident that holding your therapy for that duration of time is safe? It's a very individualized discussion, but certainly for select patients, surgery could be indicated even in stage 4.
I agree. I think very, very personalized and individualized, and it is often a rarity to do. And so I want people to understand if your doctors are saying it isn't something advised, it's not because they don't want to cure you. It's just that it carries a lot of risk, and it's probably more harmful than any type of benefit in that scenario.